Hello and welcome to this episode of the Rockin Wellness Podcast. I am your host, Rachel Joy Olsen, and I'm here today with a very special guest, Dayna Pinel. Dayna is a registered nurse and Menopause Society certified practitioner dedicated to empowering women through the complex menopause transition. Holding a Bachelor of Science in Nursing and a double major in microbiology, immunology, and biochemistry, her strong scientific background grounds her evidence based practice. With a clinical background in labor and delivery and 6 years in emergency medicine, Dayna brings a dedication to empowerment and advocacy to every client interaction. Dayna originally opened her business with the Mama Coach, a global team of registered nurses and nurse practitioners with a plan to work with newborns and mothers. However, when she recognized the critical gap in education and support for women in midlife, it led her to pivot, becoming a specialist immersed in perimenopause and menopause care. Today, Dayna offers one-on-one client support, integrating lifestyle changes and evidence-based treatments to reduce symptoms alongside educational workshops. Her ultimate vision is to ensure every woman feels informed, educated, and ready to advocate for their health during this significant life stage, becoming a specialist immersed in perimenopause and menopause care. Okay, thanks for being with me here today, Dayna. So excited to have you here. Wow, quite a bio. So why don't you just tell us a little bit, kind of why did you choose? Like, what is the kind of the deep reason you went into labor and delivery? You were working with babies, and now you decide to work with mamas, and especially those who are menopausal, which, you're not even in that age group yet. So why support these women, which I think is fantastic, by the way, because I think I am in that age group. And so it's very exciting to have somebody as educated as you, as experienced as you, to be a support for women like me. So tell us a little bit about this journey.
Yeah, thank you, Rachel. My journey is kind of always a little bit strange. I originally was a super science kid. I was going to be into science and finished that. Absolutely loved it. Started my master's and realized that the lab is a lonely place, and I didn't love it. So then I went into nursing. When I got out of nursing school, I actually did my final practicum, which is like sort of a large component that we do at the end of our degree, where we're hands-on with patients. I did that for in labor and delivery. And I actually came out of that and I was like, I will never do labor and delivery. Like, it's not what I'm going to do. And then there weren't a lot of job openings, and I sort of was applying to everything in Alberta. And of course, labor and delivery was the offer that I got. So I took it, and it was really hard to start. But a few months in, I realized I loved it. I loved the flow. I loved supporting women. I loved seeing all of the craziness and chaos and brilliance that happens in those rooms. And I really begun to kind of fall in love with it. And I did it for about 4 years. But I wanted to move back to Calgary, which is what sort of got me the emergency medicine spot. I did some extra training and applied for some jobs down here in Calgary, and I got the job in emergency. So that's been another big learning curve and leap. And I just love that about nursing, that we can do extra education or try a new spot and learn all these new skills. The Mama Coach was sort of a 2 a.m. Facebook scrolling rabbit hole. I found it and thought, well, this is cool. And then the more I read, I was like, I could work with babies again. I miss babies. And I got into it. And then as I was opening everything up and sort of looking through, I saw the women's health stuff and I was like, oh, that's interesting. And I realized that I'm in my 30s, mid 30s. Like you said, I'm not there yet, but I have done a lot of education. I've done sciences, I've done nursing. I'm in my mid 30s, and a lot of the information I was seeing, I didn't know. And I was like, if I don't know this, other people don't have any chance at just knowing this. They're not going to find out. And I think for me, it's really about supporting women to make their own decisions and their choices with the best resources and knowledge that we can give them. And I just really wanted to be a part of that. So I've enjoyed it and I'm in it now and learning more and more every day, but I
For
love it.
sure. Awesome. Well, now, of course, I've got more questions from everything you've just said. Okay, let's go. Let's rewind back for just a second.
Sure.
What made you think I will never work in labor and delivery when you were first going to school?
Oh gosh, I can't even totally remember. It when I was doing my practicum, it's a strange flow. Sometimes, and we worked 12-hour shifts often. And sometimes you're sitting there for like 4 hours and nobody comes in labor and you're just sitting there waiting for them. And of course, you've started to fall asleep and it's exhausting and it's like 2:30 in the morning. And then of course the elevator doors would open to this screaming, chaotic disaster. And it was like, ah! And I just thought, this is insane. Who wants to do this? I want to know what's going on. And then of course, I've just embraced that chaos and rolled with it through most of my career. So
Well, and now in
yeah.
emergency medicine, that chaos probably never ends.
No, it doesn't.
Okay, great. Now, the next part of the question is the Mama Coach. So, tell me a little bit about that organization. So, just, you obviously saw it. I love the TikTok rabbit hole. I mean, most of us end up down those rabbit holes, I'm sure. But, I was looking into the organization a little bit. It's very interesting. Can you tell us just a little bit more about the Mama Coach and kind of what the organization is all about?
Yeah, it's super inspiring. It was actually started by another registered nurse here in Calgary who sort of, I think, started becoming the mama coach and then realized that she couldn't see everyone that needed this, education and support. And she started this really kind of brand and team. And so we all own our own private practices. We work under our own skill sets, but there's a few different divisions of the Mama Coach. So there's the maternal and child health side that does a lot of one-on-one with women around that labor time, prenatal classes, breastfeeding help, newborn care. They've extended into solids, like starting solids with your child, potty training. So there's lots of support there, and I am hoping to expand my business into doing that because I would still love to work with kids. I'm in the toddler phase myself, so I'll probably start with the potty training because Lord, it is a thing. I just think all these things that they've really brought together so that they can help educate nurses and nurse practitioners, and we can go out and help support women. So I've just really appreciated that. It's global in the fact that we have nurses in Canada, America, the United Kingdom, Australia, and New Zealand. So expanding all the time, but we're it gives you that team environment, that really good support. It's important in clinical practice to be able to bounce ideas off of other providers. So if we get stuck, there's lots of support for us to ask people who have been at it longer or have different resources. So I think it's just a great team to be a part of.
Yeah, that's great. Sounds like a great organization and what a good opportunity for nurses who want to do something just a little bit different,
Yeah,
but yet
absolutely.
still have your own business.
Yeah,
Yeah,
yeah.
I love that. Okay, well, let's dig into kind of what we are here to talk about today. And I'm sure some of my listeners for sure are just chomping at the bit to learn some of this information from you, as am I. So, super excited. So, why don't we start with the very first question of what is perimenopause? And if you can explain some of the symptoms, some of the common symptoms that women experience during this time of their life that may even tip them off to the fact that they're in perimenopause.
Yeah, yeah. So, yeah, the first time I got asked this question, I was like, what do you mean? And then the more I thought about it, the more it was like, yeah, it's not that simple. So, perimenopause, it literally means kind of around menopause. So, we say that it starts either when your menstrual cycle starts to change or you start to have the menopause related symptoms. So, whenever that kind of begins, up until almost 12 months past your final menstrual period. That whole area is perimenopause, and it can last kind of 7 to 10 years. It can last a really long time. And then a lot of women don't realize that menopause is just sort of a day. Menopause is the definition of when you've gone that full 12 months, that full year without your final menstrual period. So, congratulations, that's menopause. And then the next day you wake up, you're in postmenopause. So, that's sort of how they've arranged these stages. Um, Symptoms wise, it's challenging and complex, and I think that's why it can be hard for people to recognize. A lot of the big symptoms that we know about, the hot flashes, the night sweats, they can actually come a little bit later on in that journey. You can get things like your cycles changing. So Plus or minus kind of a week in your cycles. You can get changes in the flow that may become heavier or lighter, changes in your, you can have more bloating, more kind of PMS symptoms in a month, like just feeling that awfulness. Can last a little bit longer when you're changing your cycles, just because of the point at which you're in your menstrual phase changes. A lot of women also experience brain fog or confusion. They talk about feeling like they can't remember things or just not feeling themselves mood-wise, not being able to regulate their emotions the same way. Um, and then the list just goes on. There's over 50 symptoms. Some of them are super weird. Frozen shoulder is one that I've heard quite a few people. And other joint aches and pains. We can get a lot of weight gain as we go through this, and very abdominal focused weight gain. Our weight sort of just starts to shift to the area that we really don't want it. Um, and then yeah, I think those are kind of the big ones, but there's a lot of different symptoms. And then as you kind of move along your journey, we can also have some, urinary symptoms. So urinary tract infections, just changes to the skin and everything in the vaginal area. So all of those types of things can start to happen as well.
Yeah, so the body just goes a little nutty.
Oh yeah, I call it a roller coaster, but nutty is a great term.
For sure. I used to work with a lady. This was a few years ago before I started jumping into this phase of my life. And I remember she was full on in it. And she's like, oh, this menopausal brain. I wish people would understand that it's not me. Like, I'm not just, what she's kind of said? Like, I'm not just flighty or I'm not just
Mm.
losing it, right? She's like, this
Yeah.
menopausal brain is a real thing. And I remember sitting there going, really? Right. I just didn't quite believe it at the time.
Yeah.
And, then seeing all these other symptoms, I've got quite a lot of the symptoms. I don't have the hot flashes and stuff, but it's quite a lot of the symptoms that you explained. And you just start to feel like your body isn't yours anymore. At least that's like, it's like, what is this body? Like, what used to work for me for lifestyle changes, diet, exercise isn't working anymore. And I've heard that a lot from a lot of women, that all of a sudden that sort of thing has to change. And we'll talk about that in a bit. But it can be so frustrating for women,
Yeah.
right?
I
Who are
think
starting to feel different.
Yeah, I think we have a little bit more understanding of what happens to women after they have babies. It's just, I think, a little bit more well known. And we all know, we all talk about the mom brain. But after you have given birth is another time in your life where your estrogen really goes from that high point to that low point. So, think of it sort of as you're going through that phase again. You maybe don't have the newborn and hopefully not as bad of sleep challenges, but women do go through sleep challenges and things, and that roller coaster of that estrogen really does affect kind of our ability to process information. And I think we're normally such good um, you know, uh, multitaskers, and we're usually in charge of multiple schedules and kids and housework and life and careers. And it really, a lot of women find that really concerning that they're not able to manage the way that they normally are able to.
That's right. And I find it's really sad that there hasn't been a lot of support. I mean, I think there's more and more support now. And so that's been really hard on women. I'm assuming a lot of women probably experience depression and anxiety, thinking, why can't I do this anymore? I used to be this and now I'm this. I would assume it's probably similar to almost like a postpartum, right?
Yeah. Yeah, it can be very mood affective for
Hmm.
sure. And some women do kind of end up on anxiety medications when there might be other options for managing those symptoms
That's right.
that aren't really looked into.
So how can women, so question here is like there's a lot of these symptoms and as you said there's probably a list of 50. So
Mhm.
when a woman starts getting some of these symptoms, how does a woman differentiate between normal menopausal changes and signs that indicate maybe a greater need for medical attention? Is there those signs or opportunities that could come up?
Yeah, so with menopause treatment and care, it's really about sort of providing the best quality of life. So most of the recommendations are based on, and this is also hard to gauge, but whether you're having moderate to severe symptoms. So if it's something that's really affecting your ability to function in your life, your comfort level, if you're not feeling like you can be you, that's when the recommendations are to maybe start on a hormone replacement or another non-hormonal therapeutic regimen. So it really sort of depends, I would say, for each woman where that line is. Some women are less bothered by certain symptoms than others. Some can function differently. So I think it's a challenge. One of the big things in this sort of age range, unfortunately, is that it's not super simple. And because the symptoms are so vague and vast, it's challenging to diagnose menopause and perimenopause. And a lot of practitioners are not as familiar with the fact that you can have those symptoms so early on in your transition. So it can be challenging to kind of know that that's what you're in when you're in it. Is really the biggest story I've heard is that a lot of women just struggled not knowing what was going on for so long. And then it's like, oh, hang on, I'm in menopause. So I think the bigger problem is identifying that that's actually the problem.
So that's probably why I'm assuming. So you and I have had a conversation a little bit before as well, but I guess that's when, women start feeling these symptoms, they start feeling off, but you can't really pinpoint it. It's just sometimes it's just a bit off. And then their doctor says, "Well, there's nothing wrong with you." Right?
Yeah.
Or you're just being crazy or whatever that might be the wrong word, but this it's nothing. You're fine. Or some women that I've heard are like, "You're too young for that."
Yes.
Right?
Yeah.
And then the doctor says, "Just, come back in a few years." So if they're told that, just come back, you're fine. When would someone start seeking out treatment then? So their doctor has ignored them. What do they do from there? And then we'll talk about some treatments after that.
Yeah. And it's hard to hear that. I think a big component of me for a big component of my work is advocacy. And I work within the healthcare system and I work with all sorts of doctors. And we treat and we're comfortable with what we know. And unfortunately, menopause care and women's health in general hasn't been, like you say, highlighted and really championed. So I think there's a lot of practitioners out there that they're not pushing you away because they don't care or because they don't think that what you're saying is your truth. There's just a lack of understanding about kind of how to treat that or things that they could tell you to do. And they're really ruling out if there's anything big, bad, and ugly that they can treat. And when there's nothing there, there's nothing there. So I think the thing there is not just advocating for clients and patients and women, but also advocating for the education of our practitioners and within our kind of healthcare system. And I think that advocacy is getting there. We've had some big developments this month with the FDA. And I think we'll get there, but it takes time to learn this information, and it will take time for practitioners to feel comfortable with this information. So it's just going to be a process. There are a lot of kind of menopause specialists that have arisen. I know there's lots of clinics here in Calgary. They do have long wait times. But I guess the biggest thing I would say is if you're having challenges with your practitioner, even just advocate for the referral to those clinics so that you can talk to someone who's a bit more comfortable, has done a little bit more, is a little bit more focused.
For sure. Yeah, I love that. And it's just like anything. It's education at the practitioners just as much as the patient. I know I had
Yeah.
asked my doctor about HRT. I've done my own research as well, and she was like, "Oh yeah, no problem. I'll just put you on it tomorrow if you want." Like
Yeah.
she was really like, "Yeah, if you want it, no problem at all." And she goes, it basically changed my life. I've seen many women who are thriving on it, and she's like, absolutely, you just tell me when, kind of thing. So,
Yeah.
I think again, she's more probably educated in it. She's probably more experienced, maybe even personally, being in her stage of life as well.
Yeah.
So let's talk a little bit about that. So, what are some of the natural, maybe, and medical approaches to managing symptoms and menopause that you work with your clients to help them
Yeah.
manage these symptoms?
Yeah, because I know you're really focused on sort of more of the holistic natural wellness as well. And I think a big part of this is that there are a lot of things that we can do to support ourselves through these symptoms. And it's not things that when you go into your doctor's office, they maybe have the time to support you through that. You have a 15-minute appointment, and unfortunately, that just is usually set up with like, this is your diagnosis, this is the treatment. And like you were saying before, a lot of women are finding that the diet and exercise changes that they used to do that worked great are no longer working. And part of that is these sort of physiological changes your body is going through. So I really work with women. We do a number of different components. So there's sort of four pillars to the Mama Coach model, and one of those is nutrition, and we break it down into two different kind of arms. And it's really adding in things to your diet that will help to support sort of the best metabolism and digestion, because these are things that start to slow down and we struggle with, that ends up with that extra kind of abdominal pouchy fat that we don't love. And then once we've kind of added in those things, then we start to kind of scale back on some of the other things that are probably less helpful, like the refined sugars, red meat, things like that, the extra fats that maybe aren't helping us so much. So I
What are
do a
some
lot
of
of
the things, if you
education.
don't mind me asking, what are some of the things that you are recommending to women add in? Because I love that that was your first thing. I love that your
Yeah.
first thing was adding in, because I'm a big proponent of that in my lifestyle coaching as well. Like, let's see what we can add, and then the other stuff might just melt away, right?
Yeah.
Let's make room for the good stuff. So, what are some of the things that you see for most women who are lacking that need to add in?
Yeah, yeah. I would really say initially a focus on protein, getting enough protein, getting the right types of protein, um, and really bringing that into the diet. And part of that is it kind of does help with that hunger. So you sort of on the back end up hopefully eating a little bit less calories throughout the day. And then it's really good for us building our muscles. It's important for a lot of our cellular functions to have that protein in our body. And then adding in things like fiber, appropriate hydration, so drinking enough water in the day, which, as far as I know, no one actually does. We're all trying to attain, right? So, adding in those types of things, and then supporting like good omega-3s, omega-6s, things like that.
Yeah, and then as you mentioned, exercise. So you talked about how protein, of course, super essential to keep our muscle tone and our muscle health. And
Mhm.
so is exercise. So you recommend regular exercise. Is there particular exercises for women that you recommend?
Yeah, I think a lot of the women I work with, it kind of depends on where you're starting at, where we start with our exercise. And I'm not a fitness buff. I haven't been. I'm one of those like I need to start listening to a bit of my own advice, so I'm working on it. But I understand adding things into your busy life. So I really start with the basics, like just moving. Move whatever you're gonna do, just start with moving. And I find the more you get into that and start really thinking about that, the more we can build. So starting with something as simple as just walking enough, right? So if we can do a 20-minute walk a day, and whether that's a full 20 minutes or 10 minutes in the morning and 10 minutes at night, I don't care. Just aim for 20 minutes of really trying to actually walk. So a moderate, brisk pace, get your heart pumping a little bit, and start there. And then women in this age range, we really want to think about our bone health long term. Fractures and things and osteoporosis are a big issue for women as we age. So a lot of the recommendations I have for, healthy women in their 40s is like, great, it starts to get harder from here to build these things back. So if we can start really thinking about that bone health and building that strength into our bones, with weightlifting, and a bit more exercise that way, then we're setting ourselves up for longevity.
I love it. As somebody who's been in the health and fitness industry for 30 years, it's
Yeah.
exactly what I would tell my clients,
Yeah.
right? You just got to meet them where they're at. And
Yeah.
one conversation that I've had a lot with my clients and then just women in general, whether it's my friends or people I come across, is that, what we were able to do in our 20s, I used to train hard,
Mhm.
hard. And anytime I try to do that now, my body's like, yeah, that's not going to happen really
Yeah.
anymore. So, you know, so I think that's another thing, right? Is just recognizing that women, what you maybe used to be able to do you might have to shift, right? You might not be able to do some of those same things, but movement is so key. I was talking to a lady, she's 75 at the gym the other day, and she's so fit. Like I aspire to be like her. She's so fit. And she just said, I know that the regular movement is what has kept me healthy, ever since my 40s or 30s or wherever, she's been. And she's like, I see so many people in my age group who, can't even get out of a chair. And this
Yeah,
lady's rocking fitness classes.
yeah,
Like
yeah.
she would probably show me down any minute, and she's 30, almost like, yeah, almost 30 years older than me. So movement is key. Like you said, whether it's just walking, whether it's, lifting stuff, we need to be able to do that.
Hmm. And it doesn't have to be a huge commitment. We can do what we can do. I think a lot of women, and I myself struggle with actually getting the time. But that's a big part of it is just that like you don't have to set aside an hour a day. We can start with where you are at and just increase basically just where you're at, increase a little bit. If that's the only thing I can push is just try a little bit more.
That's right. Just, I love that. Just a little bit more. It doesn't have to be stressed. Now, as again, that's kind of now what I want to talk about is part of lifestyle is stress management, right? That's a big one for mamas, for women into their 40s. So, how does stress management play a role in this kind of overall well-being during the stage?
Yeah, it's definitely something I hear a lot from women. And I think everyone in this kind of age range is
Hmm.
just we're balancing multiple things. And women in our generation, with people living longer, you're balancing more than one task at a time. We have bigger careers than we maybe used to. With our parents living longer, a lot of women in this 40s age range are dealing with not only raising their children, but also supporting their aging parents. So you're just pulled in all these different directions, and it really doesn't leave a lot of time for kind of looking at yourself and kind of thinking of that self-care. So part of what I really work on is honestly sleep. Not having a good appropriate amount of sleep is just setting you up to fail, really. If you're having challenges through the day, you can just, if you haven't had the sleep, it's harder to deal with them. Your mood starts getting worse, your anxiety and depression, it all just sort of compounds. So I really start with most of my clients, just working on sleep and starting by, people say, oh, I don't sleep well, but it's like, why? And then they sort of look at you, well, I just, it's like, why? Why are you waking up? What's going on? What can we do to fix the sleep? Where do we
Oh,
start?
that's a good question because you're right. So many people just say, "Oh, I'm a bad sleeper," or I'm not sleeping." But I love that asking why, and I bet you most people couldn't tell you. So,
No.
what do you find that there are some common reasons when women come to you that you
Yeah.
can pinpoint?
I do have a lot of the night flashes causing issues with the women I work with, but it can even be things like they're just so busy that they don't, they end up not realizing and they're awake until 11 or 12 o'clock at night, and then they have to get up for 5 or 6 to get, the whole household ready for the day. And then that just doesn't, there's not physically enough hours in the day for that sort of timing. So it's really being sort of conscious about prioritizing sleep, and prioritizing it a little earlier in your daily routine. So I kind of joke about it because a lot of the stuff I was learning, I was like, this is sleep training for my toddler. So I tell women like I'm going to sleep train you. Like this is what we're gonna do, and it's gonna sound kind of silly. But it's really about setting up those strong routines that work for you, and it's different for everyone. But work for you, for your body to sort of realize like this is the time that I'm gonna sleep, and I'm gonna sleep for a good length of time.
Sleep is a big issue. It really truly is. And that sleep hygiene, we hear kind of a lot about that, and
Yeah.
I know it's not easy, but I think it's a really important thing to focus on.
Yeah, yeah, it's huge. And it's something that I think a lot of people struggle
Yeah.
with. And it's not as easy to put in that routine as you think, right? We have super
No.
busy schedules. It is not that easy to wind down. Like, telling someone to calm and take a soothing moment before you lay in your bed. And it's like you've just put like for me, I guess I'm in the phase, I've just put my kid to bed. I've finally got like a second to myself. I'm running around trying to clean up the house and make lunches and And then you're like, oh, right, Zen, like this is okay. And it just is not that easy. It's not as simple as it sounds.
That's right. And when you're busy and you've got toddler and you've got family to, we
Mhm.
kind of think of sleep as the secondary thing.
Yeah, you do it when you're done the rest of your day, right?
Right? Yeah. And that old adage of I'll sleep when I'm dead, I think a lot of people still kind of run their lives like that because we live in a
Yeah.
world of go, 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 more, more,
Yeah.
more.
Yeah.
That's one thing I teach in my yoga and stuff is just slow down. You got to slow down. And people come to a class, they're like, oh, I had no idea how good slowing down actually feels. And like anything else, you've got to schedule it. You have to
Yeah.
schedule that time, right?
Yeah.
It's not just going to come. You've got to schedule it.
Well, and I'm so glad you brought that up because things like yoga, right, is where we can work on learning that for ourselves. Because it's not just a skill that just happens, right? Being able to shut those things off and calm yourself down, it's a skill. We need to practice it. It's like any other skill. And if you don't practice it and work on it and build on it, you're not going to get better.
100%. And I always say that a lot to my clients that, okay, you're taking the time to work on your physical body, just
Mhm.
like, working at the gym or whatever activity you happen to go. But what about the brain gym? What about training your mind, learning those skills? Just like you said, you have to practice it, you have to learn it, and then
Mhm.
take the time to do that. So it's so much easier almost to take care of our physical body. And we forget that the most important organ it is in our head. And
Yes.
we need to work out that as well.
Mhm.
Yeah. So, okay, so we've talked about some of the lifestyle changes that we can do.
Yeah.
Now, let's dig into what I think a lot of women want to know about, and that is hormone replacement therapy. Now, I think for some people, they hear that and they're like, eek, scary. I don't know if I should do it because, it's this big bad elephant in the room, I think, for a lot of people. But then other people, and especially people in my life, have been like, oh, it's changed my life. I couldn't imagine not being on it. So,
Mhm.
if you don't mind, I would love for you to discuss some of the benefits of HRT, some of the risks, who might be the best candidates for HRT, and also who might not be a candidate for
Yeah.
HRT. Can we chat a little bit about that?
Absolutely, I'd love to. So, I think the big thing that I found with this is that it's unfortunate the view that we have on hormone replacement therapy. There was a large randomized control study that was done and released in 2002, and they actually released to the media that they had found that hormone replacement therapy was causing an increased risk of breast cancer in the patients within their study. And this sort of caused, obviously, pure chaos because at that time, a lot of women were on hormone replacement therapy. Breast cancer treatments weren't where they are today. So, it was a huge concern. Women stopped taking it suddenly. Practitioners stopped prescribing because, what would be worth that risk to a woman, right? And I totally understand that. But then we sort of had this lack of education. The more that we've looked back at that study and the data from that study, unfortunately, a lot of those claims were less than truthful. So the evidence that they found was not statistically sort of significant where it would really hold up value within the scientific community. And then along with more research that we've done and the better understanding that we have now, there's a lot of changes to the type of hormone therapy that we use now, rather than what we were using during that study. And then also actually what that study has actually shown is there was two different branches. There was a branch that were taking both estrogen and progesterone treatment, which you do need if you have a uterus to be taking progesterone treatment with your estrogen. And that branch was the one that they had claimed had the increased risk of breast cancer. And there were some increased participants. There was no increased mortality from breast cancer. So that was significant. There were more diagnoses, but no extra sort of it didn't worsen the disease. And then the other arm, that was the estrogen only arm, actually showed a decrease in breast cancer risk. So what they've said now is that it's not causing it, and if anything, there may actually be a decreased risk, which is a significant kind of 180 and a big revelation. And then I don't remember what the rest of the question was.
Yeah, no, that's okay. Okay, so that's really good to know. So it's interesting how
Yeah.
they've made some of those claims based
Mhm.
on kind of one study that wasn't even scientifically significant, which seems really strange to me.
Well, I don't want to misrepresent that. So this study was a large study, and scientific research is very expensive. So this is probably one of the largest studies of women in this age range that we're ever, likely to have. So not that the data wasn't significant, and we've pulled a lot of data from that study that's really brought us to where we are today. It was just the sensationalization of that one kind of piece that I think was really sort of maybe inappropriate at the time. And I do think it maybe was a bit more of a media storm, unfortunately, that has just stayed with us for the past generation.
Right. And the sad part about it is it didn't spark people to look into it deeper. It just kind of
Mm,
stopped it because it was quite
yeah,
expensive to do, obviously, and then the
yeah,
results. So
yeah,
since then, so now that, because I've seen a lot of physicians and, a lot of buzz around that very thing, exactly what you're saying is that, they made these claims based on not 100 studies, but like one,
yeah,
basically.
yeah,
And now that they're looking back, the research is showing there's a significant amount of benefits to HRT. So, what
really.
are some of the benefits that your clients have seen or that you see from a woman having significant symptoms going on HRT? And then let's talk about the other fact of, we look at the benefits, but what are some of the risks and who may or may not be a good candidate for HRT?
Yeah, absolutely. So, I would say some of the long-term benefits that women are going to find, other than the symptom relief, which I think is why a lot of women go to it in the first place, are there has been a lot of research done on it slowing the progression of bone disease. So it helps to support our bone growth and the strength in our bones. So helps to steer us away from that osteoporosis, which is maybe not something a woman in her 40s is really thinking about, but something that a woman in her 70s and 80s could be really struggling with. So if we can start to support that bone health now, because as you age, it's just going to keep degrading and getting worse unless we support it. And estrogen is a really important part for women of really having those stronger bones and helping to support that as we age.
Mhm.
The other thing that it has been shown is a decreased risk of heart disease. So part of this is just that estrogen really affects the skin and the vessels. So it helps to keep the vessels in our bodies sort of more elastic, which slows us moving towards those heart disease and those kind of hardened arteries that cause these clots to form, and leading to that. So I think for long-term benefits for women, those are sort of the most proven data-wise that I can really say with pretty good assurance that we've shown that when started in the right woman at the right time, we can have some protective effects for our bones and for our cardiovascular systems, which are massive. Those are
Mhm.
are huge lifestyle factor things that you would deal with in your elder years. Other things that have been kind of flown about that I think we're still working on really finding the research for are things like cognitive changes such as dementia. And I think that, I think we need a little bit more research there, but we've got quite a bit that's showing good things and that it could be helpful. And then the other one that a lot of women don't know about, and we don't always like to talk about, is the genitourinary syndrome of menopause. So having estrogen depleted from our vaginal tissues and our bladder can really affect the functioning. It can cause a lot of dryness and skin changes that are difficult, if not impossible, to sort of reverse once they've occurred. So women will ignore things like burning, frequent UTIs, urinary urgency because we've maybe all dealt with it postpartum and we're just like, oh, this is annoying. But they don't think to go and get treatment for it. And the skin, as estrogen is depleted and as we age, it just keeps sort of getting worse. And it's not something that we can really reverse that aging process. So if we don't treat that earlier, we end up with women that are kind of stuck where they're at
Mhm.
when they start treatment, or maybe struggle with these symptoms for years and years. And when you age, getting these frequent urinary tract infections, which is kind of what that leads towards, can actually be really detrimental for health. And And urinary tract infections in our elderly population are significant things. They're not just a little like, oh, go and grab some antibiotics for a week. Like this can be hospitalizations, this can be changes in your ability to function independently. They can be quite significant
Wow, that's probably a big one, like you said, that a lot of people don't even really think about.
and don't really want to talk about, right? It's
Yeah, right. It's those weird conversations, but it's
yeah.
important to have, right? That's why it's
Mhm.
good for more people like you to be coming out and saying, "Hey, we need to pay attention to some of this stuff,"
Yeah.
because we're not. So, what are some of the risks then of taking hormone replacement therapy that they're still maybe saying that maybe so and so should be aware?
Yeah, so there's definitely some risks. I think there's risk with anything that we need to sort of pay attention to. And this was one of the great things that we did get out of that big study, the WHI study. Their average age of the women in their study was actually 63, because the study was originally built to look at cardiovascular changes on women in hormone therapy. So they picked an age group that they felt were going to have
Mm.
some heart disease and cardiovascular changes, which made sense for the study. But what we found from that data, along with the data that we have more modernly, is that the age at which hormone therapy is started really affects the risk and benefit profile. So if started within 10 years of menopause, we get those benefits where it can be cardioprotective and we see great sort of longevity with the protection there. If started later, because of the way our bodies age, and we've already had that aging process, and the way I sort of explain it is if your vessels have already become a little bit more elastic and you've started to form some plaques there, and then you start on this therapy, and now your vessels are a little bit less elastic, but now those clots are getting loose. So now we've increased the risk of having a heart problem, a heart attack, a stroke. We're increasing the risk of clots to a degree where it's probably not going to be beneficial. So the risk outweighs the benefits that we would get from that therapy. And that the magic number they kind of use is within 10 years of menopause. So there's no one that I've found has really put like an age on that. Most people go with 60, but that's only because the average age of menopause is around 50, 51. So then 60 is plus 10. But I think no one's really dove into exactly when that year is. It's just that the earlier you start, sort of the more that risk is less. And the longer term benefits are better. So the risk profile is better. Other certain concerns would be if you've had, hormone related blood clots in the past. So a lot of women in this generation have been on birth control before, which are the same hormones, really. It's the estrogen and progesterone at much, much higher doses. So if you had struggles, blood clots or problems on that level of hormone, you could have similar side effects with the hormone replacement therapy. And then there's other ones. If you're actively being treated for breast cancer, um, some of those treatments are trying to reduce your amount of estrogen within your body while you're undergoing treatment. So you obviously don't want to be taking in extra estrogen at that time because you're just sort of not following the right treatment plan, right? You'd want to talk
Right.
with your oncologist pretty thoroughly before starting something like that.
Okay, I think that's really beneficial. I just wanted to go just rewind for a second how you said that, 'cause when I went and saw my doctor, she was like, "Yeah, no problem. It's basically birth control." And I was like, "What?"
Mhm. Yeah.
She's like, it's the same hormones, basically birth control, except birth control has way higher dosage." And I was like, "What? I didn't know that. I didn't realize they're the same thing." And it's interesting. And so what's interesting about that is so many people have freaked out about hormone replacement therapy and they're throwing 14-year-olds on birth control without even asking any questions.
I know.
Like that to me, I like when she said that, I was like, "What?"
Yeah.
Like,
Yeah.
well, I would say birth control is probably causing way more problems than HRT probably ever is. Now, of course, it's case by case basis, obviously. I don't want to throw that blanket statement out there. However, I was like, oh, okay.
Yeah.
So why is there not more discussion around birth control? I mean, there has been more recently, but it's interesting, right? How a woman in menopause who's like, I just need a little help here is like, no, absolutely not.
Mhm.
14-year-old going, I don't want to get pregnant. Okay, sure, here you go. This is
Yeah.
might screw you up for in the next 20 years, that you can never have kids, but let's not worry about that right now.
I know. And I think that's a topic for a whole other
I
podcast.
know I was going to say we can't open that can of worms, but
Yeah.
it's interesting though. And I think it puts it into a bit of perspective when people are thinking, okay, well, this might be too scary for me. Well, were you okay on birth control? Did you do birth control at some point? Right.
Yeah.
Best thing I ever did personally was get off birth control because my body was so messed up from it.
Yeah.
However, but again, everybody's going to respond differently.
Yeah. But that is sort of how I initiate that conversation as well, is what were you on birth control? What were you taking? What were the side effects that you dealt with during that? The other time in our lives where we have this sort of big estrogen drop is after we give birth. So, did you have any complications? Did you have high blood pressure in your pregnancy, or diabetes in your pregnancy? Like, are there things that we're concerned about that can give us a clue as to how you might handle this transitional period?
Right.
Um, and there's no, I think every individual is their own person and they have their own story and their own sort of reaction to things. So the individualization is important. There's a lot of different routes that we can do with hormone therapy, and there's a lot of different ways we can start it. So there's some complexity there with the individualization as well. And even in perimenopause, just because your cycles are changing and you're over 40 doesn't mean you can't get pregnant. So one of the big things that I do talk about with women is if you're still cycling and you're still having sex, what are we doing about your birth control? Because sometimes I will actually say, maybe birth control is the best place to start. You get the hormones, and you're not going to get the babies.
Exactly. Nightmare at 50, right? All of a sudden you're like, what? I thought I was
Yeah.
done all this. Well, that's fantastic information, Dayna. Man, we could probably talk about this topic forever, right? Because there's so much and the rabbit holes we could go down. So, is there anything else you would like to add that, I think, well, okay, here's one more question for you is that, okay, you've got somebody's listening to this and they think, okay, great information. Where do I start?
hmm hmm
What's the first step?
I think the first step is maybe just in educating yourself, looking past that fear that you might have at the research and the understanding that we have now. And then when you're looking for your sources, find educated professionals, find good resources for your information, because there is a lot of information out there. So starting there, and then if you're interested in hormone therapy and you want more kind of information, if you go on my website, I have a free resource guide that you can sign up for. And it just gives a little bit more information on what is hormone therapy, why would I take it, those risks and benefits, and what some of the different available options are.
I love it. Well, thank you so much for that, Dayna. And so, do you want to share your website and where people can find you? I will put it on the show notes page for this podcast episode as well. But do you want to just share where women can find you for support?
So it's Dayna dash Pinel. So that's Dayna dash Pinel, Pinel .themamacoach.com. So if you go there and you just go right under my free resources tab, you can hit right to my free hormone guide.
Excellent. And you're on Facebook and Instagram, Dayna
Yeah.
Pinel at the Mama Coach as well. So people can go there. And like I said, I will put your links all on the show notes page so people can find you really easy. And there was one more thing too. You got a menopause myths webinar. Do you want to just share a little
You.
bit about that? Because I think that is going to be a really great resource for women to get started with.
Yeah, yeah. I'm really passionate about education, and I love when people come to listen to me talk. Also, you can access that on my website through classes, and I try to keep up on workshops and stuff through there as well. So keep an eye on there, and I'm starting to run more workshops. I really enjoy it. It's just getting it all together and getting the information.
Awesome. Yeah, I think that education is so important when people take the time to learn it, right? So I'm
Hmm.
assuming when people get your free resource, they will also stay updated on different events and things like that through your communication.
Yes, absolutely.
Perfect. Well, thank you again so much, Dayna. What great information that I'm sure so many women going through this stage of life will find useful. I'm excited to learn more from you as well personally. And so, yeah, thank you so much for everything that you do for women. And it was lovely to chat with you.
Yeah, thank you so much for having me, Rachel.
Thanks, Dayna. And for everybody listening, until next time, keep rocking your wellness. Thanks for joining me on this episode of the Rockin Wellness Podcast. Make sure to visit my website at www.rjowellness.com, where you can subscribe to the show and check out all the show notes. While you're at it, if you found value in this podcast, if you'd simply tell a friend about it, that would help out too. You may choose to join the R.J.O Wellness community to take advantage of the freebies, courses, and coaching that will take your voyage to the next level, or support this podcast with your monthly membership. Until next time, my friends, keep rocking your wellness.